This is the Psychedelic Medicine Podcast.
Hello and welcome to the next episode of the Psychedelic Medicine Podcast. I'm Dr. Lynn Marie Morsky, your guide in this journey, and today we're going to be discussing the use of psychedelics for addressing chronic illness with Christina Kantzavelos. Christina is an international psychotherapist, coach, writer, and artist who specializes in treating clients with chronic illness and complex trauma, utilizing various modalities, including psychedelic-assisted therapy. Now, before we get to Christina, just a reminder that the Psychedelic Medicine Podcast is for informational and educational purposes only. Nothing here is to be construed as medical or legal advice. And one additional reminder, as always, if you are a clinician and you'd like to learn more about the use of psychedelics in things like chronic illness and other mental and physical health disorders, please check out the Psychedelic Medicine Association. It is our mission to get you feeling comfortable having conversations with your patients about psychedelic options for things like these illnesses. And we want you to be ready for those questions when they come because we know they are coming. So please check us out at psychedelicmedicineassociation.org. Now, without further ado, thanks so much for joining us today, Christina.
Thank you for having me.
I'm really looking forward to this conversation. And I know, and we'll get into this, that this is a this specific topic very early in the infancy of anything resembling research, but as we've done in other episodes, we will extrapolate from what we do know from research and what people like yourself have gleaned from working with clients to try to get a roadmap of what we think that psychedelics in this, what we know that you've seen in your clients and what hopefully we'll see in the research in the future. So if you could start off by telling us a little bit about what brought you to working with patients with chronic illness.
So I had no intention of going into this field in the sense of I was in the humanitarian world. I was with NGOs doing international disaster work, and that was my dream. I just wanted to be boots on the ground, helping people wherever, whenever I could. Red Cross, eventually, it was supposed to be with Doctors Without Borders. And anyway, I was with an NGO in Mexico after the earthquake in 2018, and I got really sick while I was there. I ended up in the hospital. Things got worse. I had to break my contract, come back to San Diego, where I was living at the time, and I was passed around like a hot potato. And I should say first, I have had chronic illness since a really young age. Like I had various symptoms. I was diagnosed with hypothyroid in high school and POTS, which is dysautonomia, when I was about 19 years old, celiac, but I was able to continue my activities of daily living. It wasn't really impacting how I functioned. In retrospect, I see how it impacted the way I functioned, but I was able to function nevertheless. And when I came back from San Diego, I just got worse and worse and worse. I returned back to my hospital job and home health, and you can't really faint on the job, I was not doing well, and I was just kept being passed around from doctor to doctor, and, steroids for acute reasons, I understand, but they were wanting me to take them on an ongoing basis without trying to understand what was the root of the disease in my body, what was causing all of this. So eventually I saw this renowned rheumatologist and Lyme literate physician, Dr. Schickman in San Diego, and he took one look at me and he knew immediately. And I'd known about Lyme disease peripherally, had not realized or thought of it as something I could have had myself, or that it was triggering all my other autoimmune responses. So this is when I began some really deep healing work. I was pretty health conscious before this point, but I really got into it on a mind, body, spirit level. I truly started and began understanding that connection and what it would take to heal that. So of course, I realized that trauma was a factor and is a factor when it comes to chronic illness. I realized that nervous system dysregulation is a thing, and we're going to get into why psychedelics help with that. But basically, I looked for a therapist I could find that treated chronic illness. I could not find anyone for the life of me. And long story short, as I began to heal, because I became bedbound, couchbound, I was so ill. My mom had to give me showers and baths. I could not take care of myself. But as I got better, I decided to step into becoming the provider I so wish I had when I got really, really sick. So that's what I'm doing now. And I'm integrative. I use all kinds of modalities, and I don't just treat someone's depression or anxiety or complex trauma. Like, I see it as everything is interwoven and related to each other. And it's important that we look at the entire mosaic piece rather than just focusing on one area. So, yeah.
I love that. Thank you for sharing. And you led right into the question I was going to ask next, which is, can you talk about some of the common, let's say, mental health presentations that seem to appear in those with chronic illness?
Definitely. Oh gosh, there's so many. I want to say first, something I almost always see is medical trauma. And the way trauma plays out is different in every single person. And the other thing I want to say, I have seen without a doubt every single time, is someone is stuck in a chronic stress response, fight or flight. And we forget there's two other F's. There's freezing and there's fawning. And freezing is what we do when we can't physically flee a situation. And I see so many people in functional freeze from day to day. Like, they're essentially just masking, they're just taking the steps to function, to survive their days. They have a lot of indecision fatigue. They procrastinate quite a bit. I see folks who, they have a ton to do on their to-do list, but it just feels better to stare at a wall, and I've been there. I understand that. And then fawning is that codependent piece. It's the putting someone else or other things ahead of yourself as a form of regulation, of keeping yourself safe. So freeze response and fawning are the two I see most commonly interchangeably. And what I want to say is, when we're stuck in that chronic response, our brain is perceiving there is a threat behind us at all times. And we have to convince the brain that perhaps it was threatened at various points in our life, but we don't need to be stuck in that response, in that hamster wheel of survival. We can get out. We can have a more flexible nervous system state. And when we are in that chronic response, healing goes on the back burner, right? We have so much cortisol pumping through us that it's going to affect our immune system function. It's going to affect our autonomic nervous system function. It's going to then affect our hormones. It causes this ripple effect until we say, no more. We are putting an end to this. Let's go. But in terms of what it can present like, I mean, there's anxiety, there's depression, there's panic disorder. I mean, Lyme disease alone has over 300 symptoms, many of which are psychological and psychiatric. Anything from schizophrenia to bipolar disorder. I have seen those symptoms either reduce or go away completely with proper treatment. So it runs the gamut is my point. Yeah.
And you made an interesting point right there, because when you said proper treatment, I'm assuming you mean of the underlying condition.
Exactly. Sorry, I should have said that. Yes. Yes.
Because I think what is a great thing to bring up at this point is that when you're addressing somebody with chronic illness, there are two fronts on which things need to be treated, right? Like the underlying condition, if treatable, hopefully needs to be addressed. And then any of the psychological sequelae, which is more where you as a social worker and therapist come into the play, right?
Yeah, definitely. And that's what my requirement when someone works with me is, that they are concurrently seeing I'll call them root cause or integrative doctors at the same time, because I can only go so far with them. We need to work together to get to the root, the biochemical reason of why they got sick in the first place. And then we have me, and that's the mind body connection.
I love that. Thank you for putting a fine point on that, because, uh, you know, understandably, people with lifelong illnesses, and like you said, many have been passed around. I come from the slightly like empathetic side on the doctor side, because we don't know about all of these, right? Like I could tell you so little that I learned about Lyme, for example, even less about mold exposure, which, like you and I were discussing before, is very prevalent in
Yeah.
San Diego. So if
Yeah.
somebody came to me with mold symptoms, until I lived in San Diego, it probably wouldn't even cross my mind, right? And I would feel so impotent as a healthcare provider. And just know that like that person is not trying to blow you off. They may have absolutely no idea how to help, and they're passing you to somebody else is like, okay, I hope this next person has more of an idea than I do. And it's frustrating all around, right? And so understandably there's this kind of distrust of the system because people get passed around because there's a lack of knowledge. And so I really appreciate you putting a point on there is still a role for that medical practitioner to be doing the root cause. Like you're not going to heal your Lyme disease with EMDR or psychedelics, right? Like you still need to heal whatever is physically wrong, and those are all part of getting you completely whole again. But one just healing the psychological does not, like you said, heal the root medical cause.
Yeah. Yeah. I always say like the way we get sick is going to be the way we get healthy. And it's not just the psychological factor. It's lifestyle and it's biochemical. And if it's Lyme, there's spirochetes. How are we taking care of this? It's not going to be via EMDR, as you mentioned. The reason it's so important though to see someone who's chronic illness literate as a physician though is because there have been physicians that have been harmful in the past, I'm sure you're aware of, when someone says to you, it's all in your head,
Yes,
right?
absolutely.
Your
Absolutely.
your lab results are within range. I don't know what
Yes.
to do. So there is that, and I think there's so much power as a provider of any kind to realize, where that line is for you, and to say, okay, I actually don't know anything past this point, so I'm actually going to pass you on for this reason. And
Yes. Yes. And
yeah.
and that yes, the pass on and not the dismissal.
Exactly. Exactly. That's a
Thank you
great
for that
delineation.
clarification.
Yes,
Yes.
yes,
Yes,
yes, yes.
absolutely. I you need somebody who knows more, not there's nothing wrong with you.
Yes.
Yes.
Or it's
Very
in your head. Yeah, yeah, it's in your
yes.
head and go see a therapist because there's nothing wrong. Like whatever you're experiencing is very real to you. And I always say healing happens when someone just stands in front of you and says, I believe you. I
Yeah.
believe you. Let's
Yeah.
figure this out.
Absolutely. So let's start talking a little bit about how psychedelics can be helpful in this. If you could start by, even before we get to, your own experience with patients, what we know about psychedelics and how that makes it seem likely that they would be helpful in these situations.
Oh, yes. Well, in any case, there is those who know what neuroplasticity is. I'm sure, well, should I mention it
Go for
for
it.
those who don't,
Anybody
right?
arriving to this podcast today?
Yeah, yeah, you never know. So neurons that fire together, wire together. So we what we have noticed, especially when it comes to someone with chronic illness, is that there are a lot of these kind of going through our brain, through our nervous system, telling us that we are unsafe, that we are really sick, and they get stronger and strong. These neural pathways get stronger and stronger the more we kind of feed them, essentially. And what we have found with psychedelics is it shakes things up. It allows your brain to become more plastic in the sense of malleable, where we can see new neural pathways taking place. Like, oh, there is hope, or I can see my illness, or in this way. It's no longer my identity, or what happened to me happened. So often we hear this happened for me and not to me. It gives you this different perspective. And we look at psilocybin, magic mushrooms, for example, too. And we find that they're neurogenic. They're creating new brain cells, which is incredible for so many things, be it pain, be it TBIs, traumatic brain injuries, like the list goes on and on. But what I really love about psychedelics is that it interferes with our, like, the way maladaptive behaviors, basically. So think of someone who's been sick for a long time. We naturally become hypervigilant. We are afraid of what something might do to our body, what might make us feel. And for example, I had mast cell activation. I still do technically mast cell activation syndrome. I was down to less than 20 ingredients I could safely eat without an EpiPen because I had anaphylaxis and hives and so on and so forth. And so my brain ended up just finding triggers everywhere to protect me. And ultimately, I was living in a room and barely came out of it because I was so afraid of the world and smells and foods and so forth. And with psychedelics, and this is after we'll get into neural retraining. I did a lot of neural retraining, which is amazing as a preparation tool for psychedelics. I feel like I was given a new life to live, truly. And I hear this from so many people with chronic illness who've sat with medicine, because it provides you with that different perspective on what has happened and what is happening. It reminds you of who you are, and you get to take your power back. But in addition, ketamine is the legal psychedelic right now. Various states are working on legalizing other psychedelics. I think New Mexico yeah,
Yes.
just legalized, right? Psychedelic assisted therapy, right? For
Psilocybin assisted for a number of specific conditions. Yes.
yes. Woo! Amazing,
Yay.
amazing. And yeah, it's an immunomodulator, so it really strengthens the immune system function in essence. And it's been great for things like Lyme disease, like other um, diseases, basically. So anyway, yeah, there's a long list of benefits from being able to sit with it on a mental and physical level.
Yeah, I'm glad that you brought up, and I had just written this word down and then you brought it up, but the word is identity. And
Mm.
I would love to hear how, I mean, I know this is a very delicate area, but some people with chronic illness, like you said, build an identity around being a person with that illness. And how do you convey to them that somehow separating themselves from that identity is going to be of benefit?
Definitely. There's Dr. Ben Hardy, be, do, have. So if we decide to hyper identify with something, we will subconsciously take the steps to ensure that is or remains our identity, and then we have it. On the other side of that, when we are able to say, I am healing from, let's just say we're going to use Lyme disease as an example. It's separate. It's something that is happening to us versus it is us. There is a huge difference in that. There's a state of empowerment versus disempowerment in identifying with our chronic illness. I'm not saying that it's not real and it's not happening to you, but it definitely is not you. It's something you are experiencing. Even if it's chronic and lifelong, it's still something you are experiencing. It's not you as a whole.
Yeah, and I think that I'm thinking back to like the amount of Instagram profile bios that I've seen that literally list people's condition to front and center. Like, here's my name, and this is I am, let's say, you know, Lyme is an example. I see it very often with ADHD or neurodivergence, that kind of thing. And some of those are things that you have, like you said, some, and then others are things that, like with Lyme, hopefully you can recover from. And all of them are hopefully things that, like you said, the more we don't identify with them, not in any kind of negative way, like be proud of who you am and whatever you are dealing with. But like you said, to make it an identity kind of reinforce seems to reinforce it. And at least in social media, I think there's people that for better, and not for better or worse, but for better, they've been like champions for their condition. I just wonder like what effect that has on them, that they have to continuously be a representative of that condition to continue their kind of like lifestyle and livelihood and all those things,
Mm.
when ostensibly they would also be trying to heal at the same time. And so I think this is where I see it a lot, is in social media, that now we want to kind of feel like we're so separated as a society that we'll even try to belong based on things like diagnoses. And I think that actually helps people a lot of time, especially like I see it in the autism community that there's, a kinship of people that otherwise would be very often very isolated. But what is that balance between, identifying with your disease to your detriment versus like finding community and purpose through it?
Definitely. Like you said, you see it in so many places. I see it in the also like the Facebook group. So I think there's it's the couple things all at once. Folks had to fight so hard to get a diagnosis, to be believed that finally, when they do, it's like this feeling of not just like validation, but it's like they feel vindictive. Like they're like, yes, like vindicated. Like
Yeah.
I, it wasn't in my head. Like I did have this. And, a lot of times their family does not believe them even after the diagnosis. So here they find this online community and identity where there is a sense of belonging, and finally like I'm being heard and I'm being listened to, and it feels so good, and there's that dopamine and that serotonin that we get from it, and it just keeps going and going. And what the issue, the challenge with that is, again, be proud of advocating for yourself and getting that diagnosis. That's amazing, and getting the treatment. But when we again hyper identify with being a victim of something, which is often what happens when in fact there are treatments. People do place Lyme and other diagnoses, even autoimmune diagnoses, into remission. When we back ourselves up to a corner with an identity, it doesn't leave us much room to exit. And who are you without this identity anymore? I mean, that's the biggest thing that comes out of my appointments sometimes. Like, who are you if you heal from this? And healing is an interesting term, right? How do we define healing? Like, are you able to, you still have the diagnosis, you still have some symptoms, are you still able to function day to day? But basically, I see it as like going from, from survival to thrival. Like you are able to thrive despite having this diagnosis. Like it isn't you. It's something you've experienced and to some degree are still experiencing, depending on what it is. But that's that's how I see it. And in these Facebook groups, I actually encourage my clients to get out of them, because often I call it's like a race for victimhood. Like you're there to get help or support or insight, and there's a lot of shaming that happens in these groups. I have clients who have been traumatized from some of these groups, from what they've said, or sometimes they're worse than the doctors or the family in terms of invalidation. And I remember, even for myself, I was in these groups many moons ago, and I'm going to talk about neural retraining in just a moment, but I was saying I was in a mast cell group, and I had said something along the lines of, I'm considering DNRS, dynamic neural retraining system. It's a program for healing the nervous system. And someone said to me, it does not work. If you have anaphylaxis, you're gonna like not take it seriously, and something terrible is going to happen to you. Along those lines. It was really scary. And then I was thinking, maybe I shouldn't take this seriously. What do I do? But ultimately, it was their fear being projected onto me. It had nothing to do with me. But anyway, that's what a lot of everything is, right? Is projection. So, with neural retraining, this actually is a perfect segue. If you decide to complete a program, and I call neural retraining basically physical therapy for the nervous system. So there are various programs out there, like I mentioned earlier. DNRS, Goop does another famous one. Primal Trust is another famous one. And they work off of neuroplasticity and getting your nervous system into a flexible state. We don't want to stay completely regulated, because life is going to happen. And we want that limbic system, that reptilian brain of ours, to jumpstart if we need to survive. We just don't want to stay there, right? So really, truly, usually you're in these programs for about 6 months of daily practice, and you notice your nervous system calming down. You're less reactive, you're more responsive, you're able to tolerate scents or like smells or food, or your pain levels aren't as intense as they were. Your fatigue is less than it was before. It does wonders for dysautonomia. It does wonders for so many different things. And one of the rules in a neural retraining program is not identifying with your symptoms, nor your chronic illness. And for myself, that was huge. I mean, I went through the whole identity crisis of who am I if I get healthy? Who am I if I don't this, I worked so hard for this diagnosis. Who am I without it? Um, so anyway, this is one of those things, neural retraining is one of those things that really prime you both for deep trauma work, such as EMDR. It's why I require it for us to start irrigating that trauma. And then I really encourage it for anyone sitting with psychedelics to make sure that they are resourced, their nervous system has enough square footage, is what I call it, so that when things come up with medicine, they're able to be with it. I have noticed that, any of my clients who've gone through neural retraining have had little to no bad trips. Which is amazing. And I feel like that's partly because they worked so hard to resource themselves in advance.
Very interesting. And
Yeah.
I'm thinking of the order in which, you're suggesting doing it before psychedelics, whereas you mentioned that psychedelics can be neuroplasticity agents, which would, in theory, help you with the rewiring. So is there ever a place for some, not anything on like the high dose level, but like low doses of psychedelics taken before in conjunction with these DNRS?
Yes, yes. I would say, like, for example, microdosing actually does really well with DNRS because it aids in uh, further ensuring the brain is plastic and able to take on these new tools, these new resources, and create those neural pathways of telling yourself, I am safe in this moment in time. And yes, I'm going through something that's really hard and challenging. And I believe there's hope for this to shift and change for me.
I love that. I love that. I'm learning something new today, this neural retraining. This is very cool. Um, let's, if you don't mind sharing some stories of maybe, obviously de-identified patient scenarios that where psychedelics have been really effective.
Oh my gosh, so many things. So, for example, the reduction of the perception of pain, right? I have seen pain reduction in so many of my clients. So I treat chronic illness and chronic pain. And what people don't realize is pain actually starts in the brain. We have found time and time again that it's in our brain. So it is 100% something you would see someone who specializes in it within the mental health field for. So that has been fantastic. Lowering inflammation, and I'd love to do research on this. We discussed this right beforehand. I've actually seen an increase of natural killer cell count in those who have microdosed psilocybin and taken larger amounts. And that's what I really want to, I'm fascinated in researching this because often the natural killer cell count is so low in folks with chronic illness. So what, as an immunomodulator, right, it's decreasing inflammation and it's helping with your immune system function. So that's something else I have found. So thus, we're seeing a decrease in other symptoms. And then when you take it concurrently, let's just say microdosing, I'm noticing that there's more of a shift from sympathetic to parasympathetic, so fight or flight to rest, digest, and heal. It also, so if you take it in a larger dose, you'll notice this obviously more acutely, but even with microdoses, you'll notice this over time, which is that it interrupts rumination cycles, like different loops, and so forth. Um, I've seen a decrease in overall just depression and anxiety. Um, and what it's been able to bring to us. Like, let's just say I'm doing integration after someone sits with a larger amount of whatever it is. What they're able to bring for processing is always just magnificent that, the medicine was able to show them what they were ready to start processing. And there's just an increase of empathy and compassion within themselves and their upbringing and what they went through. It's there's this I've found folks are able to take accountability and responsibility for their life versus, basically putting it on, I'm not saying that, your family didn't traumatize you or anything like this, but realizing, okay, that did happen to me and this is me now. And this is what I'm going to do to ensure that I live the healthiest, most healed life possible, which is incredibly empowering to be able to do. Um, yeah. And I think that, there's a book by Dr. Gabor Mate called When the Body Says No. I don't know if you've read it or heard of it.
Heard of it,
Fantastic,
yes.
fantastic read about chronic illness. And um, people like folks I've worked with are able to understand when and why they got sick. When did I go into fight or flight? So the amount of insight and self-awareness and compassion and love that this brings to them is just profound. And then you have these physical pieces that are also interconnected and just so valuable.
And I imagine for those who have something along the lines of, an ego dissolving experience, that has to, I'm assuming, help with that identity piece that we were discussing.
100%. Again, it's that whole like what has happened was for me and not to me, including this illness. And I am not that. I am me. I am this brilliant mosaic piece because we are. And we have this tendency to, another thing psychedelics, can help with is helping us feel our feelings, including our anger and our grief, these emotions that we, for some reason, have evolved to think are ethically wrong, when in fact, they're just as valuable as happiness and joy. Often, moving through the anger, the guilt, the shame, the fear is how we get to that joy and to that gratitude and profound and deep love for ourselves and our world and humanity in general.
And I'm imagining that healing that, like anger specifically, I, I'm sure there's some, maybe the cortisol pathway, but like it has to be pro-inflammatory, right? Like things like anger and stress. We know they set off cortisol. I'm assuming, inflammation as well and all of those things. So it seems to follow that as you're healing the inflammation with the immunomodulation properties and you're healing the brain with the neuroplastic properties, that decreasing the stress is like everything's working in concert, seems like.
Exactly, exactly. And I also tell my clients that when they cry, a lot of folks don't know this. When they're emotional tears, not from cutting an onion, they have found that there are actual toxins in our tears. So we are detoxing, and tears are a way of regulating our nervous system. It's so like feeling is healing, truly, truly, truly. The only way out is through in all of this.
Yes. Oh, absolutely. Okay. Please tell me if there are any areas of this topic that I have not asked about that you would like to cover, because this is just like this is a wealth of information. I'm loving this so much.
Um, Yeah, I'm just trying to think. Like what we do know about psychedelics is they do, reduce inflammation. That's really big. Also, cytokine, reducing cytokine expression, immunosuppression. Um, and if you are someone listening who has chronic illness, ensure that you talk to a doctor who understands chronic illness and psychedelics before venturing into it, for medication reasons, right? You want to make sure that like a lot of
Preach.
times,
Yes.
yeah, a lot of times ketamine actually does work with a lot of what's out there. Psilocybin too, but like for example, ayahuasca, not so much, not so much. And I couldn't sit with it for a long time because I was on asthma medication, for example.
Yeah.
That would not have been good news. So find the provider that you feel safe with and believes you and who's able to look into this as much as they can. Because something we mentioned earlier is, the research is still coming out about how this affects the immune system function. And I've gone to quite a few conferences, and there's only so much. I'm always looking for it because I nerd out on it. But really, truly, find the provider that you feel best and safest with before deciding to move forward with anything. And yeah.
That was such a good point. And to your point, we have a critical mass of Psychedelic Medicine Association members that we are working our next step. We are rebuilding the website to be a little more svelte. It's a little heavy at this point. It loads slowly. So once it's lighter, we are going to put up a directory of our clinician members because they will be educated on those kinds of interactions. And so like we want patients to have a directory of how do I find a clinician that knows the answers, right? Like short of going on LinkedIn and being like, it's just, stalking some doctors. Oh, this one seems to know something, right? Like we want there to be a way that those patients can find those clinicians. We started doing that in Oregon just for the people of Oregon because they were going to need PCPs that could tell them before they went to the Oregon psilocybin centers, hey, will any of my medications interact? How about my first degree relative history of schizophrenia? Like all those questions.
Yeah.
So we created a course for the providers in Oregon. And so just know that we are working toward because we know, let's just be honest, as a patient, it is hard. It's hard to find a therapist. It's hard to find any practitioner that takes your insurance, much less one that you can afford who also knows about root cause medicine, about the chronic illness and psychedelics. Like, let us just acknowledge that this is not easy off the top. And so if it means anything, we are working very hard to make some of these things slightly easier for you. And just because I had a patient who didn't know this, Psychology Today, the website, you can, because people looking for a therapist, he was like, I can't find somebody who takes my insurance. You can filter by insurance on that website. So just random piece of knowledge for people looking for a therapist. But I do want to acknowledge how difficult it is to be a patient with any condition, much less kind of a difficult to suss out, diagnose condition. And so thank you for putting a point on the fact that it's really imperative that they see somebody who knows about medication interactions and contraindications and all of those things. That was just music to my heart. So thank you. This has been just a glorious conversation. I've learned so much, and I'm so glad that you're doing the work you're doing. And by the way, I also wanted to shout out, when you mentioned the cytokines, we did an episode maybe 3 or 4 years ago with Caitlin Thompson on psychedelics for autoimmune disorders. And, obviously there's been more research even since then, but if anybody's already, their interest is piqued by this episode, please check out that episode as well. And in the meantime, Christina, can you tell people where to find you and learn more about your work?
Sure. You can find me on Instagram and all social media at Begin Within Today. And my website is beginwithintoday.com. And thank you to everyone who listened. Thank you so much for inviting me to this. It warms my heart that this was even a topic of interest. And I think it could really help so many. And if you're someone moving through it with chronic illness, I just want you to know I believe in your body's capability to heal itself in any capacity. So.
Such a beautiful ending. Thank you so much, Christina, and to everybody else out there. Until next time. Thanks so much for listening to the Psychedelic Medicine Podcast. If you enjoyed what you heard, please leave a rating or review as it helps others find the show. And if you'd like to learn more, you can find the show notes at plantmedicine.org/podcast, and there's information for clinicians at psychedelicmedicineassociation.org. Our incredible music was by the one and only Porangi. We'll see you next time.